Good morning, everyone. Welcome to the second API West Bengal State Conference. I am Dr. Rajat Dasgupta, a proud family physician, and no, that doesn't mean I am the referee for the family arguments over the TV remote. It means I treat everyone from toddlers who think crayons are food to grandmas who swear turmeric can cure Wi Fi issues. Let me take you back to the start. When I joined MBBS, I was bright eyed and ready to conquer the world with a stethoscope. I thought I would learn to save lives, cure diseases, and maybe, just maybe, become the next Grey's Anatomy star. But then the reality hit. Preclinical, paraclinical, clinical, it felt less like medicine and more like surviving an academic obstacle course. And I realized why most doctors specialize. Because trying to master everything in medicine and is like trying to drink from a fire hose while solving a Rubik's Cube blindfolded. Early on, we were trained to think in blood tests, x rays, and textbook cases. If it was not in the labs, it is not real. But once internship and house job began, something odd started happening. Patients keep coming back. Same complaints, same medications, same all normal reports, and yet they are not fine. So I did what any overworked intern does, give them a painkiller, maybe a multivitamin, smile politely, and move on. Other patients has a long list of problems and a longer list of referrals. One for the heart, one for the lungs, one for the foot, and one for the fact that they are just tired of being referred. Then came my rural posting. That's where I met family medicine, not as a term in the textbook, but as a living, breathing, game changing way of practicing medicine. At first, I was told family physicians were just the jack of all trades, master of none. But what I learned, we are not masters of none, we are masters of what matters most. We don't just treat cough and colds, we treat people. We connect symptoms to stories, disease to lives. From womb to tomb, diapers to dentures, we are always there. So let's see what makes us different. Specialists, they zoom in like they have got a medical telescope. We zoom out, wide lens, panoramic view. We are the first point of contact, the ones who hear, I am not feeling well. We offer continuity. We remember your childhood asthma, your dad's COPD, and that's you are allergic to your neighbor's cat, and we advise accordingly. We coordinate your healthcare journey because without us, patients are often driving in circles. And most importantly, we care for the context. We have time to ask, what is going on at home? Are you sleeping well? Is your job stressing you out? Sometimes that's the actual diagnosis. Believe me, if medicine is a symphony, specialists are the soloist, each amazing at one instrument. But we are the conductors. We ensure everything plays in harmony. If healthcare was Bollywood, surgeons and cardiologists are the stars. We are the directors behind the scene, making sure that the plot actually makes sense. A surgeon says that gallbladder has to go. We say, sure. But let's talk about your diet, stress, sleep, and who will be cooking after your surgery. Why does India desperately need family medicine? Here is the very uncomfortable truth. We are building more super specialty hospitals than ever, but also seeing more chronic diseases, confused patients, and broken healthcare journey. Family medicine is the missing link. If we think of chronic diseases like diabetes, hypertension, depression, these need time, trust, and long term care, not a 5-minute consult and a prescription. If we think about accessibility, one trained family physician can save hundreds of unnecessary hospital visits and thousands in medical bills. If you consider fragmentation, you know the solution. We can fix that. We connect the dots and see the full picture. Right now, our healthcare system is like a cricket team with only star batsmen and star bowlers, but no captain. Let's break it down further. When you think about non communicable disease tsunami, we manage it. When it comes about the rural and urban healthcare gap, believe me, we are trained to serve anywhere, city clinic or village outpost. If you talk about cost effectiveness, we believe that prevention is much cheaper than a bypass surgery. And we, the family physicians, we are also pandemic tested. Just think who handled the triage, the panic, the counseling, and the continuity during COVID? We did. Family doctors kept the ship afloat during those COVID pandemics. Let me come to the final thoughts. In a world obsessed with high-tech scans, multi-organ workups, and 6 minutes consultation, family medicine asks, what's really going on? We are not just healers of disease, we are healer of people. We don't just build prescriptions, we build relationships. So when someone asks me, doctor, what exactly do you do? I say, I am a family physician. I specialized in being human. And if India wants a healthcare system that truly works, one that compassionate, accessible, and complete, it's the time we stop treating family medicine as optional and start putting it at the heart of the care. Thank you very much, and let us keep making healthcare human again. Thank you.